Western Connecticut Health Network is it's an organization that's committed to serving all the communities where we belong, and it's Danbury Hospital, New Milford Hospital, Norwalk Hospital, and a large medical group called Western Connecticut Medical Group that serves our population in many different communities, from Southbury, Connecticut to Kent, Connecticut, down to Darien, down into Fairfield, and everywhere in between. And it's an organization that's really looking to care for populations, look at the wellness of a population, as opposed to what we used to look at as, how can we really manage more of the market share. So what our goals are now is how do we manage the population of the communities we serve. And so we're looking at healthcare in a very different way than we used to. We're looking more about how do we keep people healthy and well outside of the hospital, which is a real change for us, and how do we get out into the communities with more preventative medicine and provide those programs that support people's care out in the communities. The genesis of Western Connecticut Health Network has always been around caring for the community that really can't care for itself in some cases. So all three hospitals were based on the mission of individuals from the community who wanted to provide the opportunity for those who couldn't provide for themselves the health care that they needed to either be well or to be cared for when they were injured or sick. And so all three hospitals were really founded on community, and they continue to be funded but through community philanthropy constantly. And it's really the communities that make up the three hospitals that we operate today. I think it's a little bit of both. I think from the advantage side is we're a little bit smaller, we're a little bit more personal. We know you well is our tagline, and we believe in the size of our structure, the size of our organization, and the way we care for our patients. We can meet that commitment of knowing our patients well and caring for them in the way they need to be cared for as individuals. And so that's an advantage for sure. And we have as I said, a number of organizations throughout the region where we can provide those services. I think on the disadvantage side is what the advantage of larger health systems really is around their scale, their ability to find opportunities to be more efficient by consolidation or by removing redundancies of their overhead. So the larger scale of the bigger systems allows them to provide the care sometimes in a more efficient manner by leveraging their size and being able to really reduce costs, reduce expenses through supply costs and like as I said, redundancies that the smaller systems might have. I think the future definitely holds more partnerships for us. How they're structured, whether they're wholly owned subsidiaries or they're full asset mergers, I'm not sure what those would look like, but I think we do believe going into more partnerships in the future is a strategy we need to really execute to go forward. And I think we find a lot of opportunities, a lot of value in partnerships. So whether they're full asset mergers or whether they're looser affiliations or joint ventures, we absolutely believe those are part of our future. Well, I'm proud of everything we do. I'm most proud of all the employees, the doctors, the nurses. So I'm proud of all the work they do on a daily basis. But the key services that we offer that you're asking about are really cancer, cardiovascular, musculoskeletal, and primary care and behavioral health are the 5 key services that we look at going forward as our key service lines, what we call them, centers of excellence, if you will. And we believe those are the areas where we need to spend more resources, we need to have more services offered, we need to create more access, especially in behavioral health and primary care. That's really where it all begins for us, to ensure that we have good access to primary care, which is going to be the key to keeping all of our patients healthy and well outside of the hospital. And then of course behavioral health, because there's just not enough access to behavioral health today. So we're putting more resources in developing a center of excellence for behavioral health. Our primary health care model is really to become what they call a patient-centered medical home, and it's really where we try to focus all of the services patients need, the individual patient needs for their healthcare continuum and their healthcare services and pathways, essentially. And so that is, instead of having the patients go all over and trying to find the care, we try to coordinate all of that care for them. And that includes behavioral health. So we typically in society look at behavioral health as a stigma, and going to a behavioral health provider some folks may not be as comfortable for that. So what we're doing is actually bringing behavioral health services into the primary care office and bringing behavioral health into the primary care discussion. There are different levels of behavioral health, obviously. There's from basic everyday life stressors to more severe. And so how do we address those issues as patients come in for their primary care review and include behavioral health discussion as part of that primary care review? And it's a new model that we're having a lot of success with. We're rolling it out office by office and allowing the primary care physician and the patient to have a behavioral health provider available to them during that primary care visit if they feel it's necessary. And I think the patients are really enjoying that because it allows them to access it right away. And we're also working on a pilot around telehealth for behavioral health services where patients who have a situation happening and they need to speak to somebody, they're able to get on a video discussion with one of our providers for behavioral health services when it's needed. And this is especially helpful for us as we talked about the New Milford Hospital and for the New Milford Hospital patients to have access to behavioral health specialists more readily through the telehealth program that we're doing. My current position, how did I get there? Well, I started in 2004 as a service line executive for cardiovascular services, and throughout the years and throughout the mergers, was able to take on more and more responsibility for the network. Ultimately, when the 3 hospitals came together, I was the chief operating officer for Western Connecticut Health Network, and then about 2 years ago became president of Norwalk Hospital and the chief strategy officer for the network. The biggest challenges are actually some of the things I'm most excited about. So again, going back to behavioral health, I think that is a huge challenge for us to find a way to create access and provide services for behavioral health. And again, it's really around the access for behavioral health. There aren't a lot of people investing in that right now, and so we feel obligated to be the ones to find a way for our community to get access to behavioral health services. So that'll be a big challenge in trying to do that. We have some excellent people. Again, I think it's our people that make those types of things work for us. And so we have a community care team that's out there every day in partnership with Americare's, the Open Door Shelter, the Community Health Center of Norwalk, where we build partnerships. So again, we don't try to do it on our own. We do it through partnerships with other agencies in the community, and we organize a weekly meeting and talk about patients who are the neediest in our community, and then talk about ways to care for those patients, again, outside of the hospital. We have a statistic that we like to talk about, not because it's a proud statistic, but it's we have 40 patients who access our emergency departments last year 1,300 times. So 40 patients who came for emergency visits 1,300 times in 1 year. And we really took a look at that. We said, well, let's talk about our neediest patients and who are these 40 people and what are their circumstances. There's addiction, there's homelessness, there's all of the above, and they need help. They don't know how to find ways to care for themselves. They can't find a place to live. They don't know how to find access to health care. They're uninsured. They're jobless. They're unemployed. So we find ways to reach out to those 40 patients, and try to really get a sense of what's their situation and how can we provide a better outcome for them. And it's really amazing to watch the team go to work and find the right places out in the community for these patients. Not because we don't want them in our emergency department. If they need to be there, that's absolutely where we want them, but we feel we can provide them a better outcome out in the community with the right services wrapped around them and finding them the right care that they need. Well, we really have to provide the systems and the support to allow you to be healthier. So how do we bring you into our system? How do we create enough access for you to get the services that you need? How do we manage your care and not just provide the care each time you come in to see the doctor? So we look at the patients holistically. We have a lot of investments in information systems that allow us to track the care of the patients across our network. So from a primary care physician to a specialist to their emergency room visit or to their inpatient stay, we can see all of the data on our patients holistically. And we have care managers now that we put into the practices where the care managers can actually look at the visits. If you're diabetic, have you had all the right visits that you're supposed to have with the specialist, or are you taking your medications appropriately? Are you managing your levels of sugar? And we do that. We manage and monitor all of that. So when we see a patient who's not where they need to be in terms of their care plan, we can call them in and bring them in and sort of guide them through what they need to do next. And that's new for us in a sense, because the technology is getting better, the data is getting richer, and we can really understand, where patients need to be in their care process, in their care continuum. Technology is, I think, the key. I think without the technology, without the data, and a lot of it's big data, finding what your population needs, and we do that in a community needs assessment every couple of years, and we work with the cities that we serve as well and do those need assessments together. So part of it's the big data and looking at caring for a population and what types of services do we need to have in our system to care for the community and the community's needs that we've identified through big data. But then it's getting down to the individual data and the individual patient and what their specific care needs are. So again, getting back to we know you well, each individual patient is an individual who all have very different needs and different care plans and respond differently to different signals to come back into the offices or to become healthy, to eat better, to exercise. So it really gets down to the individual data that's showing us what's happening with a patient and how can we build a better care plan for them. So urgent care centers, they play a role in the new healthcare delivery model. And what I mean by that is the patients are looking for access, they're looking for lower costs, and they're looking for quality outcomes, right? And how do we do that in a satisfying way? So those are all the things we're trying to do for our patients. So in many respects, I'd rather not see patients in the emergency department who can go to an urgent care center and have a very simple thing managed in an urgent care center. It's good access, it's lower cost, and it really allows our emergency rooms to stay open and available for patients who really need to come in and really need to be seen in our emergency departments. So we've done a number of things in our own network around urgent care and doing extended office hours, having walk-in clinics in our primary care offices to provide that access and a lower cost setting to provide the care for patients when they need it. Not every patient needs to come to the emergency department for the smaller types of things that happen throughout their lives. So I think it's an important role in the whole continuum of care that we're trying to provide. All of the finances, all of the different payer models that are coming out now are really putting a lot of pressure on healthcare systems, and we're responding to that. We're trying to find ways to be less costly, and we're working very hard at that. Right now we have an initiative to reduce our expenses and to improve our efficiencies by a number of about $70 to $80 million. It's a project we're working on right now. And so we believe we're positioning ourselves very well for the future of healthcare and how Medicare and some of the other payers are looking at paying for healthcare services and bringing the healthcare costs down, and we fully subscribe to that, and we're moving along on our journey. But at the state level, it's very different. The state level, the governor has taxed all of the state hospitals to the tune of $550 million across the state of Connecticut. And for Western Connecticut Health Network, that's a $55 million tax that we pay now as a not-for-profit health system. And so that $55 million tax is essentially our entire profit margin. So we're in very challenging economic times. The state tax on our hospital in 2012 was literally zero. And in 2016 is $55 million that we need to find savings and other ways to deal with that. So that's been very challenging, and so we're trying to find ways to get back to even and then grow again so we can continue to support the mission and become profitable to sustain all the good things we're doing here for these communities. I get that question a lot from my friends. Has Obamacare made healthcare better or worse? I think on the positive side, it got everybody more focused on what is really our mission here, and it's to provide quality care, good outcomes, satisfactory care that patients leave here feeling good about themselves, good about the service they received, and having a healthier lifestyle. So we believe in that. That's how we should be incentivized, is through healthy outcomes and great satisfaction at a fair price. I mean, that's really what it is. So we subscribe to that, and I think it's getting a lot of people focused on the right thing. What we will have accomplished in the next 3 to 5 years, I think, is really to bring a community together to provide a much healthier outcome for all the patients we serve and all the communities we serve through our initiatives around population health and around managing the lives of our populations through the communities we serve. I think it's a really exciting challenge for us to really look at how are we progressing in that goal. in terms of making us a healthier community, and that actually in the past would have worked against us in terms of lowering utilization at the hospitals. But really that's what our mission is right now, is to really find ways to make a more healthy population out there in the communities, and be able to measure that and be able to show that we can do it. And we found a way to bring healthier outcomes to our communities at a lower cost. And I think that's what we'll do.